Well, I'm very honored to start our startup panel. My name is Nancy Lee. I'm an INSEAD MBA 22J, also founder of Miso Health, where we scale evidence-based, innovative women's health solutions, let it be diagnostics, wearables, care programs, biopharma, and digital health globally in a culturally competent way. Yeah, I'm really excited to introduce our two great speakers today. So first is Monica from Wisp. So Monica is the Chief Executive Officer of Wisp, a rapidly growing and profitable telehealth service specializing in sexual and reproductive health, founded in 2018, serving over 1.4 million patients across the US. So she had served previously as VP of Marketing at 𝗲𝗲𝗹𝗁 Health, in VP of Growth of Simple Health, where she achieved significant business growth. And she has also worked in some of the most interesting, iconic companies such as Lyft, Samsung, Verizon, AOL, LinkedIn, just to name a few. And last but not least, she is an MBA alumni of INSEAD and also holds a bachelor degree at Princeton University. Monica, welcome.
Thank you. Great to be here.
Yeah. So I would like to introduce Valentina as well. I think whoever, everyone probably know the company Daye. So she is the CEO and founder of Daye, a company that manufactures novel medical and diagnostic devices for common yet underserved gynecological health conditions. Valentina has a background in public health and medical device law, and her research has been published in the Journal of Endometriosis and Uterine Disorders, the Journal of Human Reproductive, and the International Journal of Microbiology. She has been a vocal advocate for advancing women's health and has shared her insights in various platforms such as podcasts and various interviews. Welcome, Valentina.
Thank you, Nancy, for the introduction and for the invitation to be here today.
Yeah, so I think in Lillian's introduction, we already talked about the burning need of women's health innovation. I think that's why we're all here in celebration of better health, not just flowers. I would like to start a question in the word innovation, right? So it is obvious that you both took a path on innovating in different burning needs. So I want to start with Valentina. How did you, come up with the Daye, how did you identify that pain point? And I think in your case is actually a very painful pain point, literally. So I would like to hear that story briefly, and also trying to see how do you see that changing the landscape of women's health products?
So like a lot of founders in the gynecological health space, I personally experienced some of the problem areas that we're trying to solve for. I had my first painful period when I was 9 years old, and then it took me years to get diagnosed with an ovarian cyst, which was left to progress due to the gender diagnostic gap, and this significantly affected my overall quality of life. I had to miss a year from school. So I ended up having quite traumatic experiences with my gynecological health in my early years of life. And later, through conversations with my peers and my friends, I realized that the issues that I had been experiencing were actually the norm in gynecological health. They weren't the exception. They weren't the product of having really bad luck. They were actually the standard. And this really opened my eyes to the gender health gap, which everyone is very familiar with. And today I feel that solving for gynecological health and for raising the standard of care in vaginal, menstrual, hormonal health is the single most important thing that we have to do as a society before we can, look up to space and flying cars and all of the technological advances that we're excited about. We really need to ensure that over half of the population is not stuck at home with a hot water bottle or doesn't drop out of their careers at the peak of their professional development because of poorly treated menopause symptoms. And this is why I wanted to kind of throw my hat in the ring and try and resolve some of the common gynecological health pain points, which are typically underserved.
Yeah, I like how all the innovations were really oriented towards the gynecological pain points there. And moving to Monica, how did you come up, dedicating yourself to the sexual health fields, right? And reproductive health.
So Wisp was born out of the idea that women shouldn't have to quote unquote whisper about their basic sexual and reproductive healthcare needs anymore. So very much echo Valentina's experience and mission, and particularly here in the US, there's a really big gap when it comes to episodic care and treatment for really basic sexual and reproductive health needs. I think every woman on this call knows what a UTI feels like, and yet has to jump through hoops, whether it's getting an appointment days or weeks away or going to urgent care to get a basic prescription. And so that is how we're filling the gap in the market by providing same day treatment for really common yet still very important sexual and reproductive health needs, whether it's a UTI, yeast infection, a herpes outbreak. We've also more recently added treatment options in the fertility and menopause space, because our goal is to really treat women at every major life stage of their health journey, not just during a moment of a flare-up or crisis, but build in those preventative and diagnostic options as well, so that we're able to deliver on a truly holistic care model.
Yeah, I think just keep with Monica. I'm very curious. It's obvious that you are a marketing guru in your previous, career. When it comes to women's health, of course, you're solving because in women's health we say taboo a lot, and I think it's true for both cases. But I'm specifically interested in Monica. Like, how did you see scaling these innovative solutions challenging, or are there any unique challenges to women's health?
Oh, there are many unique challenges to women's health, as Valentina can attest to. Scaling a business in this space, we're constantly faced with obstacles and roadblocks. The playing field is not even. Whether we're talking about trying to get ads approved on Meta or TikTok, we're constantly facing rejections and censorship, whereas ads for erectile dysfunction, get approved left, right, and center. And so those are some of the hurdles that we've had to jump through, and we've been able to navigate those by taking a really bold and unapologetic approach to marketing. You could call it guerrilla marketing in some ways. So Wisp and Daye actually collaborated on an out-of-home campaign here in New York this past year, which was very successful. We were also the first brand to have the word vagina featured on an ad in Times Square in the New York City subway system, and helping to destigmatize the space, right? These are medical terms and should be part of our everyday vocabulary without the stigma. And so I've been able to leverage my marketing background to really push the boundaries of education and awareness in this space. And as a smaller brand competing against larger ones with hundreds of millions of dollars in funding, that's been an effective growth strategy for us, because our marketing stands out. And so we're able to be more efficient with our marketing dollars at the end of the day.
Yeah. What about you, Valentina, besides the social media, pain that we already know there?
Yeah, without meaning to discourage anyone from starting a gynecological health company, founders in our space have to overcome three main challenges. The first one is the fundraising challenge. Currently, only about 1% of the entire pool of venture capital globally gets deployed towards women's health. Similarly, in public funding, we only see about 2.4% of the entirety of public funding go towards gynecological health. So first, you have to overcome the funding gap, and this by itself is a huge challenge. If you're successful in overcoming the funding gap, then you have to overcome the data and research gap. So at Daye, we had to conduct independent clinical trials for every single product and service that we wanted to commercialize, because the data simply wasn't available. We couldn't build on top of existing research or on top of existing precedents. And running clinical investigations and doing so across multiple different geographies, if you want to commercialize in more than just one market, is challenging, not impossible, but challenging. And finally, if you've moved the mountain to get fundraising, if you've moved the mountain to complete your clinical investigations, then you're faced with the advertising restrictions, which Monica described. Today, actually, we started our first lawsuit against Google for their discrimination against our products, and we're doing so in combination with a number of different women's health companies, including a not-for-profit organization called Censor Her, which is dedicated to helping achieve equality in advertising. And as Monica said, we face censorship everywhere: Meta, Google, TikTok, Amazon, but also out-of-home campaigns. So when we ran our out-of-home campaign in New York with Wisp, there were a few members of the public that decided to censor the word vagina from our ads. They spray painted over it. And we had a similar situation happen to us with our ads in London as well, where we were showing a medically accurate plastic model of the uterus and the vaginal canal, and members of the public took it upon themselves to go and apply stickers on the vaginal canal and the ovaries because they found them to be too offensive. So these are the three main challenges that we have to focus our work on: getting more female health innovation funded, having more research so that companies can actually generate the novel medical and diagnostic devices which we need if we're going to solve for menopause, if we're going to solve for endometriosis. And finally, really taking the big advertising platforms head on, because we know we've tried to submit requests for review of our ads. There's so many different avenues that we've tried, and now we're trying the legal route as well.
This is so interesting to me because when you think about medical, in the medical field, whenever you try to scale something, you try to scale via the physicians or the provider side, right, or something else. But I can really see that you go into the consumer side and really want to empower the consumers there, no matter how much the challenge is on advertising. And I like, yeah,
that's because the system is so broken, right? Like we have to go direct to consumer because the current system is so flawed in providing like convenient, affordable access to care. Like we're a cash pay business, for instance, and most people hear that like, oh, and assume it's very expensive. In fact, we are cheaper than a copay and 10x, if not 20x faster than the traditional healthcare system. And so for an end consumer, it's a really valuable offering when you're struggling with a health crisis and don't know where else to turn. So we're filling a really big gap in the market, and we'll continue to fight the fight. Like Valentina, I think we've partnered with a number of different organizations in the space as well to put pressure on the advertising platforms, and I think it's only going to get harder, but taking legal action is the right next step.
Yeah, I think that's something maybe, we can take it offline after this meeting if you have time to stay, is really to dig in. Are there innovative ways to advertising other than thinking about the platform, right? Because I know Valentina has done some like Venn. I remember that really, really interesting way to market. But I still want to stick with Monica here because I know you have extensive background in digital health itself. How is it different with Wisp, right? And it's in terms of enhancing patient engagement and satisfaction there.
Yeah, so we've taken a slightly different approach than some of the other telehealth providers in this space, in that we've maintained our cash pay only position. The other in the space that you probably are familiar with is Hims and Hers. And we've done that and will continue to do that because of the access to care and affordability that provides our patients. I think everyone assumes you jump to accepting insurance, that's the only way to enter the space and really grow and scale. And that's not true. It adds a lot of operational complexity into the business. What's also nuanced in the space is, believe it or not, what it takes to establish a patient-provider relationship in each state here in the US is different. So we have to really tailor our operational backend and tech platform to make sure that we're compliant in each state while still providing availability in all 50 states. So what that looks like and means is, maybe for like, let's call it menopause, we can provide async consultations in 40 states, but in 10, we need to actually facilitate a video conversation with that end patient. So those are the sort of various forms of personalization and engagement that we lean into as a brand. Healthcare is also highly regulated in terms of what you can and can't market, right? And the use of private health information for retargeting. So we've had to be creative and still remain compliant, but also providing an engaging ecosystem for our patients to keep coming back. We have a very high repeat purchase rate, high LTV, because while a patient might come to us initially for a UTI, we also offer prescription strength OMG cream, which is basically a custom formulated topical female Viagra cream. That's one of our more popular products in like the sexual wellness space. So it's about building that ecosystem of engagement in a compliant yet still highly meaningful way for our community.
Yeah, it seems like community building is really important. Valentina, would you agree as well in your experience there?
Yeah, you need to have a community that can give you feedback on the products that you're developing and on the overall service. At Daye, we really like to think of our community as the co-creators of our products and services. We never want to be a type of organization where a bunch of people just sit in a room and decide what menstrual product or what vaginal health products patients should have access to. We want to invite clinicians and patients to actively take part in the product design journey. And having a strong community has really helped us there, because people get very excited when they give us feedback and they see this feedback being implemented in the next delivery that they get from Daye. We're really helped out here by the fact that we're vertically integrated. We have in-house manufacturing, so it enables us to actually make really quick iterations to the product based on meaningful patient feedback.
Yeah, I'm getting a signal here. I need to wrap up. that quick. But I really want to ask this question because I think, over the past, we all heard like, women's health is niche for years. And I think we're a bit tired, especially for people in this field, right? And we have seen indeed over the past 5 years, there are progress or getting mainstream attention, at least, or recognition in the market size-wise. But I'm curious, I know Valentina already talked about still there are painful lack of access to capital, right? Have you seen, how have you seen the trend been? Has it been better in your experience as you proceed and demonstrate your product, as you meet more investors and hopefully gaining more influence? Or is the other way around? And how are you thinking about future, plans in terms of funding or even exit, since we're moving towards the corporate panel for transition?
Yeah, I think as researchers, sorry, Monica.
All right, I was going to say you should go first since you're raising.
I think as researchers and scientists, we always have to look at the data. We can't look at personal sentiment or anecdotal experiences. And the data is very clear and speaks for itself. So PitchBook published in 2024 their analysis, which shows that the funding for gynecological health has gone down. So it's now at the lowest level it has been since 2019, where female founders get less than 2% of the overall pot of funding for innovation. And then within that, women's health receives an even smaller percentage as a whole. We're seeing similar issues with public funding. So under the new administration, the NIH funding has been completely reshuffled. We actually were supposed to have a bunch of grant funding interviews in January, which were canceled with no further comment. And I don't mean to in any way sound like a downer, but I do think we need to look at the reality of the data. We're seeing a lot of panels and breakfasts and articles written about the importance of gynecological health, but I'm not sure that we're seeing the actual tangible investment or societal change that we need to be effective beyond just paying lip service to the space.
Yeah, I definitely would echo those sentiments. When Wisp started, we intentionally bootstrapped the business because we knew how challenging it would be to raise. So we raised less than $2 million in primary capital. We're then majority stake acquired by a publicly traded company out of Canada called 𝗲𝗲 Health, and are now 3.5 or so years later in the process of exploring strategic alternatives. And I think it has been challenging. Our profile as a business, as we've grown 30% year over year, we're approaching $100 million in top line this year. We are profitable, probably one of the only profitable businesses in the telehealth space in the US, and yet still face incredible challenges from an exit perspective. The conversations that I've had really would blow your mind. And I can't help but wonder, like, would a man be asked the same questions, right? And you saw pretty big raise with Flow. They raised $200 million this year. We also spoke to General Atlantic, and their investors, when they walked out of the room, literally said to me, I've never seen a business with metrics this strong in the women's health space. And yet they chose not to invest in us and chose to invest in Flow. So like that is just a real world example of sort of the landscape today. And I think we still have a lot of work to do.
Yeah, I just have so many follow-up questions, but I have to kind of, control myself so that I don't eat up time for the next panel, which I think it would be good to transition to, where we parked. How do people see it from the corporate side? And what are other alternative options funding-wise from the corporate, thinking? So, well, thank you so much, Valentina and Monica. It's been great startup panel.
Thank you,
yeah.
Thank you, Nancy.
Yeah.